Welcome, public health professionals, and thank you for being here and listening to my proposal for an initiative to help combat the adolescent substance abuse issue in Boston, Mass neighborhoods. So, what is the issue? Well, combating substance abuse has been a long-standing challenge for the state of Massachusetts. Following the recent COVID-19 lockdown, the sense of isolation has led to a significant increase in opiate and substance abuse rates as Boston, Mass residents are dealing with worsening mental health challenges and a substantial increase in the cost of living. Some common determinants of adolescent substance misuse that we've been witnessing are behavioral, physical, and mental health disorders. And these are the most common determinants. We also see that parental substance abuse plays a significant role in a child's potential drug use, and also the prescription of opioid painkillers by a medical professional has led to serious dependencies. Some other common factors that lead to increased risk of adolescent substance use include their family environment, relationships, child abuse, and neglect. So following COVID-19, we saw a large uptick in substance abuse. The annual number of adolescent deaths from substance abuse issues increased by approximately 20% in 2019 following the end of the lockdown. The sense of loneliness, isolation, and an increase in mental health disorders contributed to the already difficult issue of adolescent substance misuse, and mainly opioids for the purpose of this program. Here we see overdose deaths among 15 to 24-year-olds. As we can see, there incorporates a few different forms of substances, but for today, I'm going to focus on opioid deaths and that green line there. As we can see, it's been increasing for some time with a slight downturn in 2017, leading to a significant increase from 2018 to 2019. So what is the proposed program? Well, the program that we propose will work with schools and parents to identify and support adolescents at risk of substance dependency. We plan to focus on boroughs of Boston where the determinants that we mentioned earlier are common and opioid-related mortality rates are higher than average. This would be areas such as Dorchester, Roxbury, and Mattapan. And I know this graph or this map here is difficult to see, but it highlights substance abuse issues and run-ins with police officers based on each borough of Boston. The more dense the black dots there, the more issues have been witnessed. And like I said, this typically incorporates areas such as Mattapan, Roxbury, and Dorchester, known for low-income populations. But participants will be identified based on their location, experience, and exposure to opioids. Once admitted to the program, methadone treatment will be provided, and this helps the individual deal with withdrawal symptoms. We also plan to provide one-on-one counseling to each patient, and this will help to support their individual experience, and the impact of the program will be measured over time through monitoring the participant's substance abuse, or rates of use, attitude toward using opioids, and patient retention of the program itself. So here we see some different prevention methods, and we call this the intersection of prevention and harm reduction. So on the left we have primary, and this would be preventing the initial use or the delay of initial substance use. This would be something like a DARE program that we see in schools. The main focus of the proposed program here would be secondary prevention methods, which is the early detection of or reduction of substance use once problems have already begun, but before the individual has formed a dependency. And then tertiary, reducing substance use problems or harms to prevent further deterioration or death, and this would be after the individual has formed a dependency to the substance. So secondary prevention, as we see here, secondary prevention programs, like I said, are recommended for adolescents who have had some exposure to an opiate but are not yet reliant on the substance. Baseline methadone treatment has proven effective for some, but approximately 70% of those who have undergone treatment end up returning to opiate use. Incorporating methadone treatment and one-on-one counseling services has shown itself to be significantly more successful, and this includes on-site medical, psychiatric, employment, and family therapy. And as I stated, it has proven to be effective for 81% of patients. Here on the right, we see a little comparison of primary prevention programs such as DARE versus no drug-related program. And as we can see, the rates are pretty similar. It doesn't seem like the DARE programs have had a significant impact, and the rates of other drug use, including opiates, are higher for DARE participants than the control group, which is interesting. In conclusion, Boston, Mass. Has had higher than average rates of substance abuse than the majority of the United States for some time. Following COVID-19 lockdown, many areas of Boston are witnessing increased rates of mental health issues, which is contributing to the already high rate of opioid misuse. By identifying and working with adolescents who have been exposed to opioids, the program aims to address the determinants that lead to opioid misuse, providing methadone treatment, consistent, individualized therapy. The initiative hopes to decrease current and future rates of substance-related mortality rates. Thank you very much for listening to my proposal. I appreciate your time.